It's the Progress Pod, a production of the Franklin County Coalition for Progress. I'm Pete Mazzoni with Jeremy Cate. It doesn't take a big percentage of fraud to get a giant number of dollars. The Medicare budget is around $700 billion a year, and it's estimated that around 10%, or about $70 billion, is attributable to fraud. The Affordable Care Act has made some progress in reining in fraud, but the real watchdogs are those receiving Medicare benefits who can ferret out care that was paid for but not administered and report it. To assist seniors in helping to end this fraud, we have with us Shelly Schwartz, a local volunteer, and from the Center for Advocacy and the Rights and Interests of the Elderly, Dan Milloy. Thanks for joining us today, gentlemen. I want to start with you, Dan, and talk about your organization. You go by the acronym Carey. Go ahead and tell us a little bit about that and what you do.
Yeah, for sure. Well, first of all, I want to say thank you for having us here. It's quite a pleasure. So Carey is the Center for Advocacy for the Rights and Interests of the Elderly. We are located in Center City, Philadelphia. Carey itself has been around since the mid-1970s. The program that we'll be talking about specifically related to fraud today began in 1997 with the Senior Medicare Patrol. Overall, Carey has multiple programs. We provide a lot of service, advocacy, education, outreach for older adults, not only in Philadelphia, but throughout the state of Pennsylvania.
What happened in 1997 to initiate this program?
That's a great question. I think there was a lot of industrial movement within healthcare, Medicare, and a lot of government oversight trying to rein in issues that had become more and more involved and developed over time, especially related to fraud. And as we all know, controlling healthcare costs has been something that has been within the purview of the government. And not only that, but people who pay into insurance on every month, every paycheck, paying attention to where their money goes in terms of healthcare. And I think the government, specifically the Administration of Community Living, really wanted to turn a brighter light onto how to help reduce fraud and save money.
What changed with the onset of the Affordable Care Act?
How much time do you have?
Much time as you need.
Well, I'll keep it as short as possible. The Affordable Care Act obviously was an extremely monumental piece of legislation that came through in the U.S. and the structure in which healthcare was reimbursed, the structure in which people gained access to care, and we talk about this triad, this triangle between controlling cost, quality, and access to care. And the Affordable Care Act really focused on improving the access to care while reducing costs. And part of that related to fraud, it was very evident that, as you mentioned at the beginning of the show, 10% of the healthcare dollars being lost to fraud doesn't take a small percentage to make a lot of money.
Right.
And I
with
think
these government numbers, it's just staggering.
It's outrageous, and I know you mentioned about $70 billion with a B. There's estimation that it can go as high as $90 billion in terms of fraud, waste, errors, and abuse.
And how is fraud manifested in terms of billing? I mean, how does it occur?
Yeah, it's interesting. So the key point with fraud to remember is that fraud, there has to be intent. If you're intending to be malicious or to be fraudulent, then we would call that fraud. There's also errors and abuse, waste as well. So when it comes to billing services, we try to caution ourselves with saying that people are being fraudulent. Most providers are acting in the best interest of their patients and would not intentionally commit fraud. However,
so this form of overbilling or?
Yeah, so when it comes down to billing, the fraud that we see would be overbilling. Upcoding is a big one, charging for services
What
that
would
never...
upcoding be? Give us the definition of that.
I can give you a very local good example. Actually, in Delaware County, right outside of Philadelphia, there's a podiatrist who was clipping toenails of Medicare beneficiaries and charging for nail services, removal of ingrown nails, and making well over 150-200% increase on reimbursement because of that. So upcoding in and of itself is basically performing a service but billing for something that is far more extensive and will garner.
And that's fraud with intent.
That is fraud with intent, my friend. Yes,
For
it is.
sure.
Yeah.
Sheldon, what got you involved with this program?
Oh, that's a long story.
I like long stories.
Okay.
Let's go.
I was living. It turns out when I was living in St. Petersburg, Florida, I got involved with the Pinellas County Area Agency on Aging, and they had a program like this there. And I said, well, I can go out and talk to folks about waste, fraud, and abuse in the Medicare program. And then when I moved here to Pennsylvania, I looked around, and the local area agency did not have this program, and I got to cast around and say, what happened? Well, it turns out that Carey has the contract with the CMS for the whole state, and they run the volunteer
before we get too
program.
far into terminology, what is CMS?
Oh, a Center for Medicare Medicaid.
Okay,
Services.
thank you. Sorry to interrupt.
Yeah, no, I do that all the time.
It's okay.
I do so many acronyms along
Right.
the way, and I'll keep asking.
I will.
So when I came here, I finally found out that Carey was the organization that carried the program for the state of Pennsylvania, and that's how I got in touch. And I got trained and started go out and giving presentations in Franklin County, and now I go Franklin, Fulton, Cumberland, Adams, wherever Dan schedules me, I go.
Now, you're called an SMP, or a Senior Medicare Patrol.
Correct.
What are you going out, and what message are you giving to people to try and get them up to speed on watching out for fraud?
Well, the first thing I ask is everybody on Medicare. I try and find out, the people in the audience, are you on Medicare, or do you have someone that you know, or are you a caregiver, or do you know? And everybody knows somebody who's on Medicare and can make a difference. And the first thing you tell them is that, do you realize there is fraud in Medicare? And some people go, no. Like yesterday, I gave a presentation at Luther Ridge, Spirit Trust Luther Ridge up on Black Gap Road. And two of the people in the audience are going this way, and some of the people are going this way, nodding yes and no.
Yeah.
And I go, well, how about $70 billion worth? And they go, $70 billion worth of fraud? I go, yes, about 10% of the budget. And then I just go, does anybody know what $1 billion is? I say, how much is $1 billion? And people look at me, and I've given presentations on this to make people understand what $1 billion is. I put zeros on a board, and they go, oh. But then I say, figure it this way. 1 second, 60 seconds in a minute, 60 minutes in an hour, 24 hours in a day, and so on and so on. How many years is 1 billion seconds? How many years is 1 billion seconds? Any guess?
Me, no.
37 and a half years.
Wow. All right.
Now, does that, to me, I see people finally look at me and go, oh, that's a lot.
Yeah. It's too big of a number to almost conceive of.
And that's the problem.
Yeah.
And that's the problem. You know, the federal budget, the dollars, you talk about billions, and people say, well, it's a billion here. What a S.I. Hayakawa used to say, oh, decimal point here, decimal point there, it doesn't make any difference.
Yeah.
But that's one of the things I try to get the realization of what the dollars are.
Mm-hmm.
And then we get into the discussion of what you can do about it. So we use 3 words: protect, and maybe I'm getting too far down, but protect, detect, and report. And I talk about, what do you protect? You protect your number, your Medicare number.
Mm-hmm.
And I told a story about, we just changed over in the United States from your Medicare number being your Social Security number, which everybody had before, and now it is now an alphanumeric number of numbers and letters that was randomly ascribed to each individual. And we think, and I'm not sure we have any evidence yet that it makes a difference yet, Dan, but we think that's going to make a difference. And the reason why is Social Security number is everywhere. It's on your bank account, your mortgage, your everything you own. So it's accessible to folks who really want to commit fraud. Mm-hmm. Now, with this new alphanumeric number, it's not out there. So we're hoping that is one leg that we can say this is going to help reduce the fraud.
Isn't it interesting? We're having to create secondary layers of identification. There's also the Real ID in Pennsylvania.
Hello.
In order to, stop fraud.
Hello.
But anyway, go on.
Yeah. No. Anyway, so then I go through to protect the number, and protect it, and I tell folks that only carry it with you, and according to the guidance we get from Carey and the federal government is to say, only take your Medicare card with you when you go to a doctor's office or a lab or something like that. And I always told the story, and I'll use it as I always do. I always tell the story. It's like me. I carry my card with me all the time. You never know when I may need a doctor.
Right.
I think about it like, well, my mom used to tell me when I left home, and she'd always say, make sure you have clean underwear on. So, I mean, right. I feel that way about my Medicare card. I got to carry it around, and it's with me all the time. So we tell folks to protect the number. Always protect it.
Now, what happens if that number gets loose and out there?
Well, then it's fair game, and there's so many examples of how the Medicare number could be used. One example. You get the Medicare number, and there are, believe it or not, unscrupulous folks and unscrupulous professional doctors and receptionists and on and on and on and on, because there's so much money involved. They're there. I can take a little bit of it and nobody will know.
Right. Skim a little off the top.
Skim a little off the top, get a little here, get a little here. But it turns out that it BMs a lot. And there was just one recent case against a company that was doing what was called genetic testing for markers on cancer. And it's pretty bogus stuff. Mm-hmm. But they built the government for $2.5 billion.
Good Lord.
2.5 through not only doing bogus testing, but also bribing receptionists, doctors, the whole chain of events to get this money.
Yeah.
And they were billing how? They were billing Medicare. So everybody that got the test got a piece of paper that said, your Medicare was charged for this. Now, how do they know that? Well, every quarter, everybody gets a Medicare summary notice. It's called an MSN. Okay. And the simple message that I give, and that's part of the detect, when you get your Medicare medical summary notice, take a look at it.
Right. Open it up.
See what it says. A lot of times it'll tell you how much you may billed by the provider. You may be billed by the provider $5 or $50 or something. Mm-hmm. So people go through it and they go, well, you may be billed 0, 0, 0, 0. I don't know any money. They throw it away.
Right.
It's true.
I believe it.
Yeah. So what we're asking, and it's a very simple thing, we say, take a look at it. See if you were there. See if you were actually at the doctor's or you got that appointment. And check it. And keep a calendar. And Dan has put together a booklet, which is like a journal that we now hand out, that people can actually mark down in there and keep track of when they go where for a doctor's appointment, a hospital, or whatever.
So recording the appointments on your end so they match up.
Exactly. Like I always show them, here's my life. This is my calendar. Okay. I carry everything I go.
He's got a nice little notebook out for the listeners.
And I say, okay, I look at it, and if it doesn't match, what do you do? In the MSN, it gives the name and the address and the phone number of the provider. You call them. Now, sometimes I will say, a lot of people look at me and say, but the address is wrong or the name is wrong. I say, yeah, I know. Sometimes it's Phoenix, Arizona, because a lot of providers use the billing services,
right.
So the address is different. But don't let that deter you. Call, and then based on their reaction, if they say, oh, we made a mistake, blah, 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 and you're satisfied, fine. But if you get guff and you think it's a farce, you think it's a fraud, whatever, dial 1-800-Medicare. That's the answer. That's the detect part. Mm-hmm. And the report is Medicare, 1-800-Medicare. Call it, report it, and feel like you've done the right thing. Okay. That's the total message of the protect, detect, and report that I give.
Excellent. Dan, what is the negative impact of all this fraud on care for the elderly?
Specifically on care for the elderly, it could be pretty substantial. Obviously, every dollar that is lost in the Medicare program is a dollar that can't be spent toward providing care toward, a vulnerable or person or older adult or anybody on Medicare who needs that coverage. Mm-hmm. On top of that as well, it's rare, but it does happen where we see issues that a compromised Medicare number will result in the denial of claims in the future. So if a person's Medicare number is compromised as a result of a fraud, then he or she might have services rendered in the future that get denied by Medicare.
Now that really makes keeping that Medicare number safe real.
Exactly.
Because if you can't get care when you need it, that's frightening.
Yeah, imagine going to your physician, having a full workup, blood work, you get
a bill.
You get a bill for several $1,000s, and Medicare denied it. Mm-hmm. That can really pose an issue for a lot of people.
There's an issue that I have as well, and that is there are a lot of health screenings that are being done in various locations by some reputable and whatever, in gyms and schools and stuff like that, where they set up and they do health screenings. And sometimes they'll ask, come on over here and we'll do your blood test, we'll do something, and they ask for your Medicare number. Once you give them that Medicare number, what happens, and I'm not saying it happens all the time, they will charge Medicare for your annual physical wellness check. Mm-hmm. Then you go to your primary and you say, I'm here for my annual wellness check. And they go, oh, you already had it.
Yeah.
Medicare's already paid for it because you had it done through this health fair thing. Mm-hmm. So that's a direct impact of a potential fraud or a misuse, or I don't want to put it in a fraud category, but it could be a misuse or a misrepresentation of something, mm-hmm. where an elderly person feels like they're doing the right thing, they're getting a blood test, it's free, but nothing's
that's a
free.
Dangerous word in our society.
Yeah.
It's free. Yeah.
Nothing is free.
Nothing's free. Yeah. Somebody's paying for something.
That's correct.
So that issue is a direct health impact. Mm-hmm. The other one is, as Dan was saying, for what's called durable medical equipment. Durable medical equipment is everything from a cane to a brace to a wheelchair to anything that's used
or
as
a hearing
device.
aid.
Hearing aids are not covered.
They're not covered. They should be.
They should be. They're not here covered by Medicare. But they should be.
Yeah, definitely.
That's another issue. We'll lobby for that another
Great,
time.
please do. My dad would be grateful.
Yeah, well, I'll tell you my story later.
Okay.
But anyway, in those instances, they get an unscrupulous doctor. One woman I talked to when I was giving a presentation, she was saying that she was signed up with a company, I can't use the name, in Florida, and giving for her husband's diabetes equipment.
Okay.
And they were signing her up for receiving the needles and the prep, all the stuff.
Right, everything you needed.
Everything you needed. And they kept calling her and saying, well, you need some more. Well, I don't. Well, they sent it anyway. Well, they were sending her so much stuff, she didn't need it anymore.
So they could keep billing. Right. Dan, what are some of the signs you can tell the elderly or their caregivers to watch out for companies like that?
Well, you pretty much hit the nail on the head by saying, nothing's really free.
Yeah.
If you're out in the community or at some sort of event and, somebody is offering you a free service, whether it be a piece of durable medical equipment, a walker, cane, wheelchair, something of that sort, or genetic test, or, we'll swab your cheek and make sure that, those in your family are protected, and know if there's any predisposition to cancer. And it's free. All we need is your Medicare number. That exchange is where fraud really becomes the most noticeable and obvious. If someone is telling you a service or item is free, but asking something of you, i.e. your Medicare number.
So is there something to the asking for the Medicare number up front that seniors and their caregivers need to watch out for?
Yeah, if you need a service or if you're interested in having a service rendered to you or you have any questions, it's the best thing you can do is go through a trusted provider, your doctor, primary care doctor most especially. For durable medical equipment, I'm always a big proponent of speaking with a physical therapist or occupational therapist. But going through a trusted provider is hands down way safer. And the other problem Shelly was mentioning is durable medical equipment. Medicare will only cover one of those pieces every 5 years. So if you get scammed and give your Medicare number away and somebody sends you diabetes equipment or and back braces, Medicare is not going to cover one that you really need. And a lot of those devices are unsafe. They're not fit to the person. And
So they're just dangerous.
They're straight up dangerous.
Yeah.
They're knockoffs from China, and they cost about $10-15 to make, and Medicare will be billed around $1,000 for it. So,
do you in any way ally with Medicare? Do you work with them directly, indirectly on your programs, or do they offer any financial assistance? I mean, I would think they'd want to be on board with what you're doing here.
So it's an interesting relationship. We don't have there's no written, that I know of at least, no written relationship there between the Senior Medicare Patrol and Medicare. However, Medicare, we work closely with 1-800-Medicare, the free hotline at Medicare that you can call if you have questions about your Medicare or fraud. And very frequently, a lot of the calls that we get actually from beneficiaries come through the Medicare system itself.
So they get directed to you?
Yeah, so Medicare will send them to us, and we will send things to Medicare. So there is a sense of referral there. But as far as financial, no, we don't take any money from them.
Pete, just to accentuate the point, and I use that in my presentations, every person on Medicare gets your Medicare book, which is that thick. And it just so happens on page 97 and 98, here is the Senior Medicare Patrol that's mentioned in the Medicare book. And it's saying there's a Senior Medicare Patrol, blah, 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 this is what we do and this is how we do it. And then there's a paragraph that I always read in there that says there is a reward. If you call and they find a perpetrator and they go and they find him and they do the whole business, that you're entitled to a reward.
Interesting.
But I've asked Dan, and Dan asked everybody, and we don't know of anybody yet getting a reward.
Ever gotten the reward.
But it's written in there, and if it happens, I'd love to know.
Yeah, that would be.
Because it'd be a
It sounds to
star
me almost
somewhere.
like the carnival, the big stuffed animals on top that nobody ever
Yeah.
gets.
Oh,
Everybody's a winner.
And I tell my audience, I said, well, when was the last time the sweepstakes patrol came to your house
Right,
with the
right.
balloons?
Doesn't exist.
It doesn't exist.
Shelly,
I don't
what's
know.
some of the what are some of the concerns you hear from the groups you speak with? What's the feedback you get?
Most of it is just they appreciate. Most of them don't understand that it really goes on.
Sure.
Folks I talk to, they're looking at me like saying, "Does that really happen?"
Is that because the older generations are more trusting? Because I feel like they're targeted. My father was targeted with a scam, and he got taken.
Yeah.
And it's because he's a trusting man.
Yeah. I think, and let's face it, the scammers know that.
Yeah.
And that's why you get all these telephone calls. I mean, I don't know how many times I get a call, and I'll answer your question in a second.
No problem.
But I don't know how many times I get the call, "Hi, this is Nancy. I'm calling from Medicare, and if you don't call me back right now, your Medicare is in jeopardy and stuff like that. And I tell folks, if you get a call like that, hang up. Medicare will never call you. Medicare, Social Security will never call you.
Okay, that can't be repeated enough.
Exactly, because they might call you if you started a case, or
Right.
you've got something going, or you've written to them, or you've called them, but they'll call you in response. But Medicare will never call you. Social Security will never call you. The response I get from folks, they look at me, really? I go, right. They said, well, I got this call. I said, hang up.
Yeah.
Hang up, because it's a scam. They try to, particularly, we're getting into open season now. What are the dates?
Yeah.
Open enrollment is.
Oh, this is the time to really watch out?
yeah.
Okay.
Open enrollment is coming up.
Why is this the time to watch out? What makes this unique?
Yeah, so open enrollment every year. The open enrollment period between October 15th and December 7th is an opportunity for beneficiaries to change their Medicare coverage so they can openly shop the market for commercial, I should caution with saying commercial, managed Medicare programs. They can shop and switch their plan as needed, and they can pick up supplement plan. And this becomes an area that's extremely ripe for fraud because there's so many moving parts in the Medicare program. There's a lot of different issues that are going on. People don't know how to navigate the system. And
It is extremely complex.
yes, it's I mean, with Shelly and I could tell you we've both been around the industry. You obviously much more knowledgeable and have more experience than I do with the healthcare industry, but I've 2 degrees now in this area, and I still probably don't know more than half of what's going on in healthcare because there's so much. So then you take that and amplify it to somebody who doesn't have as equal access to information, older adults who are far more trusting, and somebody calls and says, hey, I can help get you on this better Medicare plan. It's probably not true. But like you said with your father, that trusting instinct from previous generations and older generations.
What's the word they use? No copay.
Yeah.
No monthly fee.
Yeah.
None of this. Hello.
Yeah, it's
Free lunch.
exactly. Yeah, the free lunch is a good one. There's a lot of prohibited activities that Medicare delineates that are often abused by people within the insurance industry, managed Medicare, and then...
What are some of those prohibited activities?
Well, it depends on the time period, but you're not supposed to provide a lunch worth more than a certain amount. And
Oh, you weren't joking.
No.
Oh no, this is a thing.
This is the thing.
This is very much a thing.
Oh,
There will
my
be
goodness.
brokers
Oh,
who go
yeah,
into
yeah.
senior centers and will offer an exquisite lunch, and they're not supposed to take Medicare numbers. We see that happens a lot, and the guidelines and rules are tricky during open enrollment itself, but definitely prior to open enrollment, brokers are prohibited from going into a facility and taking Medicare numbers from beneficiaries. The beneficiary can call that broker, but the broker can't solicit that product. He or she could speak about the product, say, hey, this is what we do, and by the way, here's our $20 lobster lunch. Give me a call.
It's one of the things that's really important that Carey does, and it's a little different from what we're talking about in Medicare fraud, but it's important, is that they have what's called, and the area agency on aging, all of them are in the 52 counties that have area agencies, have what's called an APPRISE program, APPRISE, APPRISE.
Okay.
And there they have volunteers who are experts in insurance.
I was
So,
just going to ask
to
where they can get
seniors-
help to navigate this. So thank you for bringing that up.
Seniors can go in, make an appointment, and talk to another senior who is expert in insurance and say, here's my situation, here's my income, here's my blah, 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 blah. What do you think is the best thing for me, or what are the alternatives for me? What should I look out for? And we have that here in Franklin County in the Area Agency on Aging.
Is there a website they can go to?
Just to the AAA website, Franklin County. Look at Franklin County Area Agency on Aging. It's in Franklin County website.
Okay, great.
And or they can dial 717-263-2153. That's the Area agency number.
So that would be recommended for anyone who's out there kind of on their own.
You got it.
Yeah.
And has any question about their insurance, particularly with what's going on with the open enrollment, now's the time they're going to have questions.
And that they'll be able to direct them and get them the right answers.
Yep.
Yeah.
Are there any other real...
There's no easy answer, because
No, there really
everybody's
aren't.
situations. No, you can't. It's
Yeah.
not a cookie cutter thing that says this is for you, this is for you. Everybody's got a different situation with respect to their income and whatever. Excuse me.
Yeah, no, and I just want to reiterate the importance and value that comes from the Apprise program. Free, unbiased Medicare counseling.
There's nothing in it for them.
Nothing in it for them. These are folks like Shelly who dedicate their time to helping other people, make informed decisions regarding their
That's some of
Medicare.
the presentations. I partner with the Apprise program, so I can talk them about this, and then they can talk about the insurance program, so we can kind of give them the balanced approach.
Yeah, sure.
And I don't know if you guys have any out-of-state listeners, but
Sure, yeah.
But if you do, those outside of the state of Pennsylvania, the Apprise program is called SHIP, SHIP. Same thing, free, unbiased Medicare counseling. Fully grant funded, just like the SMP. There's nothing in it for them. They're just folks out here to help.
Shelly, where are you headed next?
You mean today or the next day?
Yeah, as far as your SMP program.
I've got to be in Quincy Village by 3, so that's
Okay.
another meeting. But no, I'm going to continue doing what I'm doing and learning as I. And
Where can we find out about where you're giving your presentations? Is that on the Carey website?
Yeah, so
it's on the Carey web. Does it put it on the website?
we don't. That's actually a really, really great question. And
I haven't been doing it. Stacy Yurko runs the INR, Information and Resources for the Franklin County. And she said if I told her when I'm giving presentations, she'd put it in. She puts that thing out twice a week.
Okay.
And I'm sure you've seen her website, the INR website. And they can do that. Other than that, it's just the people who are at the facility who know about it. Or like if I give it at a senior center, it'll be on their billboard that I'm coming in next month
announce
or
that you're
whatever.
coming.
I don't know, or anywhere else. It goes on to whoever participates in that particular venue. Yeah.
All right. Well, I want to thank you both for coming on the show today. This is an important topic. Remember, protect that Medicare number. Go to the Apprise website during this open enrollment.
And report.
Yeah. Go ahead. Give it to us.
Protect, detect, and report.
Okay, and get that reward, somebody out there.
Yeah, right.
let us
right.
know.
The elusive reward.
Let us know if you get one.
All right. Thanks, gentlemen.
Yeah,
Thank
thanks
you so
guys.
much.
And thanks for listening. Find us online at progresspod.org.